Health isn't a perfect lab report. Health is being able to walk in the park, play with your grandkids, and enjoy a meal without a list of surgical complications hanging over your head.
My name is Dr. Davidson. I'm a heart surgeon and I'm an ER physician. You know, for close to 30 years now, I've worked right on the front lines, where routine decisions can suddenly become life or death realities. The reason I'm here talking to you today is because I'm seeing something that really scares me. I'm seeing patients who aren't just victims of a disease, they're victims of the system itself. So if you're over 70 or if you love someone who is, I am asking you from the bottom of my heart, please listen to what I have to say.
We've all been raised on this idea, right? That more testing, more screening always equals more safety. But look, today I'm going to do something that might not make me popular in some medical circles. I'm going to break what feels like a code of silence to show you why, after a certain age, that's just not true anymore. I want to walk you through how these well-intentioned checkups can go terribly, terribly wrong. And more importantly, what you can do to protect yourself.
So before I even list the specific tests, it's absolutely crucial that you understand the why behind this. Why is a test that's a lifesaver at 50 potentially a life-threatener at 80? Well, it's because the fundamental math, the whole risk-benefit equation of medical screening, it changes. And it changes dramatically as we get older.
3 really critical things happen. First, our routine scans start picking up things that otherwise would have just stayed silent for the rest of your life. These are abnormalities that grow so slowly, you'd live a long, full life and die with them, not from them. Second, the reality is an older body is just more fragile. The prep for a procedure, the anesthesia, the recovery, all of it carries much higher risks. And third, and this is the big one, these factors can trigger the most terrifying part of all, what I call the cascade effect.
Okay, so this is it. This is the big villain of our story today, the cascade effect. Just think of it like a snowball rolling downhill. It starts with one tiny, harmless-looking finding, but it starts a chain reaction, picking up speed and mass and danger until it's a full-blown avalanche. And I'm telling you, I have seen it destroy lives.
It almost always starts with something that seems so small, so innocent. You feel totally fine, but you go for a routine scan, and the report comes back, there's a little shadow. Now, of course, the doctor has to check it out.
So that investigation leads to a biopsy. And that biopsy, which is an invasive procedure, it creates a risk, and maybe that risk becomes a reality. It leads to a complication, like an infection.
And that infection? Well, now it lands you in the hospital. And we all know, a hospital can be a dangerous place for an older person. It's where you're at risk for pneumonia, or a dangerous fall, or a hospital-acquired infection.
And that's how it ends. That's the tragedy of the cascade. A person who walked in feeling great, totally independent, is now, they're not the person who walks 2 miles a day anymore. They've become the patient in room 4B, and a life is changed forever.
Okay, so now that you understand the danger, this whole cascade idea, let's get specific. Let's talk about the tests that, in my experience, most often light the fuse on this chain reaction. I'm going to walk you through the 5 checkups that I would personally question for anyone over the age of 70.
First on my list is the routine colonoscopy, and I'm talking specifically for people after age 75. And listen, this isn't just my opinion. Even the main group that sets these guidelines, the U.S. Preventative Services Task Force, recommends against this for average-risk adults in this age group. Let me tell you a quick story so you understand why.
Yeah, I'll never forget a patient named Margaret. She was 78, but sharp as a tack. Told me she walked 2 miles every single morning. Her doctor told her she was due for a colonoscopy. She trusted him, of course. But that intense bowel prep, it dehydrated her so severely that her electrolytes went haywire and her heart went into crisis. She ended up in my ER before the scope even got near her. And it's not just the prep, you know? The actual risk of the procedure itself, of a bowel perforation, that's literally poking a hole in your colon, that risk triples after age 75. For an older person, that's a massive surgical emergency. So what's the alternative? Well, if you don't have any symptoms, you need to ask your doctor, hey, what about the simple, non-invasive annual stool test?
Okay, number 2, and I know this one is going to be controversial, aggressive screening for prostate and breast cancer. We have all been so conditioned to fear cancer, and for good reason, but the data, the actual evidence for seniors, it tells a very, very different story.
Get this. For men over 70, the PSA test for prostate cancer has a false positive rate of nearly 80%. 80! Just think about that for a second. That means 8 out of every 10 high results are basically false alarms. But every single one of them triggers a wave of anxiety and usually leads to a biopsy, which has its own real risks of infection and other complications.
I saw this happen with a man named Gerald, an 81-year-old retired teacher. He got pressured into surgery and radiation for a low-grade cancer. The treatment, it left him incontinent and impotent. He lost his quality of life, the things that brought him joy, all to treat a cancer that was never going to harm him. He would have died with it, not from it. And honestly, we see a very similar pattern with mammography for many women over 70, where finding these very slow-growing cancers can lead to unnecessarily aggressive treatments. All right, number 3. This one's right from my own backyard as a heart surgeon. The routine cardiac stress test for people who have absolutely no symptoms. I get it, it sounds like a good idea. Let's just check on the heart, but more often than not, it's a search for trouble that just isn't there. That test, it has a false positive rate up to 40% in older folks with no symptoms, 40%. And that false alarm, it doesn't just go away. It leads directly to the next step in the cascade, an invasive cardiac catheterization, which comes with real risks like stroke, bleeding, or kidney damage. The truth is, you have your own daily stress test. Can you walk up 2 flights of stairs without getting chest pain or becoming terribly short of breath? If you can, you're already passing.
Okay, on to number 4, routine bone density scans or DEXA scans after the age of 80. Now hold on, the problem here isn't really the scan itself. The scan is harmless. All it does is confirm something we already know. As we age, we lose bone density. It's a normal part of the process. The real problem is the medications that often get prescribed automatically based on that scan.
So here's the crazy irony, right? The most common drugs for bone loss, bisphosphonates, they can cause side effects like dizziness, which, of course, causes the very falls we're desperately trying to prevent. They've also been linked to these strange atypical fractures. You want to make a real investment in your health? Let's talk fall prevention. Get rid of the throw rugs, install grab bars in the bathroom, work on simple balance exercises. That's what really saves hips. And that brings us to our last one, number 5, the carotid artery ultrasound for people who have 0 symptoms of a stroke. In my professional opinion, this test is often a trap. It's a simple ultrasound that looks for blockages in the big arteries in your neck that go to your brain.
So what happens is, the scan finds a silent blockage, and suddenly there's all this pressure to have preventative surgery to clean it out. But here's what they don't always emphasize. In seniors, that very surgery carries a 2 to 5% risk of causing the exact thing it's meant to prevent, a stroke. And that's exactly what happened to a patient of mine, Robert. He went in for a routine preventative surgery and came out of it with a stroke that left him unable to speak clearly for the rest of his life. Now, I need to be crystal clear about something. I am not telling you to ignore your health. If you have symptoms, if you have chest pain, if you find blood in your stool, if you have a mini stroke, you get tested immediately. This is all about routine screening for people who feel perfectly fine. So let's move from the problem to the solution. I want to give you a tool, a simple toolkit you can use to protect yourself.
This is what I call the 4 questions protocol. So I want you to do me a favor. Get a pen, write these down, or take a screenshot. This is your toolkit. The next time a routine test is suggested, I want you to ask 1, what exactly are we looking for and what's the plan if you find it? 2, what are the treatment risks for someone my age with my health history? 3, what happens if I do nothing, just watch and wait? And 4, is there a simpler, less invasive alternative we could try first? A good doctor will welcome these questions.
All right, this really brings me to the most important point of all, because all of this requires a huge shift in thinking. We need to completely redefine the entire mission of healthcare for people over 70.
This is it. This is the whole ballgame. The goal of medicine in your later years should not be to get a perfect lab report. It's not about chasing numbers on a chart. The goal should be about maximizing function, independence, and joy. Don't let the medical machine turn you from a person into a patient, a collection of incidental findings. You are a person with a life to live. And sometimes truly the healthiest, bravest thing you can do is just say no to a test you don't really need.
So I'm going to leave you with that question to think about. What is the ultimate goal? Chasing that perfect lab report or living a life full of function, independence, and joy? Look, if anything I've said today resonates with you, please share this with a parent, a grandparent, a neighbor, anyone you love who's in this age group. Let's work together to stop the cascade before it ever starts. I'm Dr. Davidson. Thank you for listening. Stay informed and stay healthy.